Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Good evening, Roxy.
Good evening, Megan.
Again, we're coming at you. It's late, 9:05. Okay, so, we'll talk about this past weekend. Roxy and I were together, which was fun, and we had big plans to record a podcast while we were together, but that didn't happen. We always have big plans when we're together, and often,
they fall short.
An eighth of it might happen. But anyway, so, Roxy, start us off. Tell us something good.
I mean, I don't want it to be too redundant, but hanging out with you this weekend was something good.
I know. Me too.
It was so good, so rich.
It was so good. So, yeah, Roxy and I were, okay, truth be told here, sometimes we do get on to record this podcast and we don't really know what we're going to talk about ahead of time. And tonight we had some ideas and just decided that both of our brains are a bit tired. And we are just going to talk a little bit about life as of lately and share a little bit about our experience this weekend with TAing the Herman Wallace Pelvic Floor 1 course, which is the foundational first course that you start with through Herman Wallace to become a pelvic floor therapist. So we're going to talk a little bit about that. But all right, Roxy.
That was my good. I can maybe think of something else. I mean, yeah, I got to see my friend Danielle right before.
Oh yeah, that's right.
She's a friend from PT school. I think good, current relationship. I mean, we're still friends, but just to catch up with people. I think that was good. That's been something I've been trying to be a little more intentional about, maybe, and just lots of
good connection.
Lots of different relationships of saying who's important to me and who do I need to really take time to connect with, and so. I got to do that right before I got to spend the weekend with Megan. And so it was just a rich, full weekend of we were kind of working and we'll, like Megan said, we'll talk about that, but also just, I think spending time with people that you care about just fills my cup.
Yeah.
So.
Yeah. It was fun because my kids are very familiar with Roxy and they were so excited for you to come and stay. And I mean, just Owen wanted to make sure that Roxy got to pick what we were having for dinner, and Grace wanted to make sure that she slept in her bed. And then when she left after the course and she didn't come back to the house, they were like, oh my gosh, she left.
Oh, that's sweet.
Oh,
they were good host and hostess.
It was so good. And I think that hosting that course and it being the first time that we hosted at our clinic, I will tell you, leading into that, there was definitely some on edge moments with Nathan and I getting that gym space ready with the tables because we were trying to figure out the positioning of how all the tables were going to fit to get the most chairs in. And the screen got put up on one wall, then we had to change it. If you could tell, both of us were a little bit is this going to work? And finally, though, we got it. And I think that it just went really well. And one of those moments where you're we did it. Okay, now we can do it again. So let's talk a little bit about, I've had this question here recently too with how do you go about if you think you want to maybe start into pelvic health? And there's a couple different options out there. The APTA has a course series. And so does Herman and Wallace. There are some other standalone courses out there, but those are the two really good you get laid down the basics on how to assess in the first course. And then from there, it just continues to grow. And so this course that we hosted was the Pelvic Floor Level 1, which is the introductory course. And so if this is, the route, sometimes people take this course just to see if they're interested in pelvic health. And sometimes people take it and they're like, yeah, this is not what I want to do. But even if you decide it's not what you want to do, you just learned a whole bunch of knowledge about a group of muscles that we don't really learn about too much in PT school, which I mean, I didn't. I know that the curriculum at Wichita State's probably changed, but Rexy and I both went there. Assuming has changed now, and I know that they offer more education as far as pelvic health goes, but or pelvic floor. Anyway, so yeah, okay, Roxy. So what was your like? What did you enjoy the most about this weekend in TAing? So okay, actually, before we start this,
Yeah.
so the way that these courses work is we are the host site, and the instructor that works for Herman and Wallace, who we had one of the best. She's so outstanding. I love listening and learning from her, even though it was PF1 that I took years ago. You still take away a nugget when you're sitting there re-listening to it. And I love Jenna, and yeah, it was so good. But anyway, so we are a satellite location. So she is in her state teaching through Zoom. So she is teaching the course content. And then when we break out into labs to learn how to actually do the pelvic floor muscle assessments, they have been given instruction via her. And then they go and perform the lab. And Roxy and I are the teacher assistants and walk around and make sure that everybody is understanding correctly and doing everything correctly, learning, have questions, all that kind of stuff. So, did it fill your cup up?
Ah, it did. No, I think it did. I think just really what this weekend probably personally showed me was like just how long and or guess how transformative like my knowledge and my career and my practice has come. Because I just remember thinking like not in a discouraging way, and I didn't say this to anyone. Maybe I said it to you, Megan, but like you couldn't pay me to go back to Herman Wallace one. Like just that point of like not of being so fresh and realizing how much time I've
I
invested
know.
into like learning and do it like trying to do better at like treating patients and practicing different skills and researching things I don't know. And I think there just was a really big appreciation of like, man, I appreciate where all these gals are right now because they're in this really exciting, fresh time. And who knows what's going to become of their career at this point. Some of them,
Yeah.
like Megan said, they might just stop at this point and they might say, you know, that was really cool. Like, I'm actually not as interested in this as I thought I would be. And I need to keep like investing a lot of time and energy and knowledge into my career. And I'm just not like ready for that. I'm more interested in like shoulders or I'm more interested in whatever, you know. But
Mm-hmm.
now I have this really good, thorough piece that is kind of missing from the puzzle, I think, in a lot of people's practice of just understanding the pelvic floor and what it does and how it can help people with hip pain or back pain or people who aren't coming to you for pelvic floor dysfunction, but maybe they have like the hip or the SI or the back pain or different, you know, more peripheral type symptoms that now these gals have like a more thorough grasp of what the body is doing and how it works, and just some treatment strategies or some assessment strategies. And so I think just understanding like, wow, this could go like an infinity number of ways for everybody. And just kind of reminiscing back to when I was sitting in Herman Wallace 1 and
Mm-hmm.
even recognizing the things that I was taught and then I learned more. Like if you just even piece out certain parts of this weekend of what these gals learned and saying, oh, I remember when that was what I knew and understood. And it's the foundation. And it's just like babies have to start with milk. And then we can start to introduce baby food. And
Yeah.
ultimately someday
Yeah.
we're eating steak, you know, and it's
Yeah.
like, I
Yeah.
remember when I was a little infant pelvic floor therapist and I was just on milk or fluids at the time, you know, and now hopefully, you know, I'm getting into like the meatier stuff that
Yeah.
is really exciting and it's always fun and new and interesting to learn. But that I think is my favorite part of this week is nothing that I did or saw or in person tangibly experienced, but just like kind of the internal retrospect and appreciation of just like how my career has evolved and morphed into where I am now. And dreaming about like what then like where I go from here and just knowing that the knowledge or the learning continues.
Yeah. I echo everything you said. I mean, there were to be in assisting with a level one and still being able to be like, oh, wait, I want to go in there and make sure I listen to this topic that she's talking about and taking like little nuggets away from it that, I mean, I think that a good therapist is somebody who doesn't act like they know everything because we sure don't all know everything.
Mm-mm.
But also reflecting the same way that you said, Roxy, of being like, wow, remember feeling so nervous and overwhelmed and kind of like, okay, well, what do I do with this information now? And I realize there's so many layers now that I've learned. And I'm really grateful for every stepping stone along the way of learning. And I'm really proud. Like like I've done this. Like I have put in invested in myself and have pushed to, if I don't know it, figure it out myself and not just be like, well, that's all right. you know, I know just having that reflection was really fun and interesting when we would talk through the case studies because you have to like hold yourself back because you have to remind yourself that it's just pelvic floor one and it's like, okay, they're looking for these like kind of just what they learned this weekend. And in our brains, it's like this spider web of, okay, well, okay, this is the problem. But you break it down, you're like, it can be this, it can be this, it can be this. It's like all these different, and you didn't want to go down too many of those pathways because they're not there yet. They're just worrying about how to assess the pelvic floor. So it was just fun. And seeing how some of them, like, really, you could tell were excited and had a lot of questions and really wanted to, you could tell, know more. And not that not everybody did, but you could just tell that there were some that were like, you could tell like there was some sort of fire ignited where, they were super excited. So anyway, our biggest advice with everybody is just to like find mentorship right afterwards if you don't have anybody to learn from so that you can start to build your confidence and decision making when treating these patients and that sort of thing.
I was just thinking about like, isn't that just like great advice for any
I think
aspect
it's
of
great
life?
advice for anybody.
Of like,
Yes.
I'm just even thinking right now, like with parenting, like we just start going through this with our life group, we're going through a little parenting like study. And like one of the first things they said was like, look for the people whose
Yes.
kids are older than yours and go take them out for lunch and
Yeah.
quiz them and pick their brain and, just learn from
Yeah.
them and be open to
Yeah.
hearing what they have to say because they've been there and they've kind of paved the way ahead of you. And it's like, man, in anything really,
Yeah.
it's funny that you said that
Absolutely.
I was like, oh yeah, it's like, I feel like I need that right now for parenting or for
Well,
marriage or for, just life in general or my health or
it is so true. I mean, mentoring wasn't talked about ever in my career when I first started. You just go get a job and you just figure it out. And yeah, you're right. I mean, now we have like life coaches and all these different, situations. But yeah, like if you find people who, yeah, like exactly with parenting who have kids that are older and you see something in those kids that you're like, wow, like that is like something that I want to see happen in my own. Yeah, like connect with those people and find those mentors. And it's in every aspect. And it's something that I highly recommend, even if you're not going into pelvic floor, but even just as just being a PT or an OT, like, or a speech therapist, whatever, find a mentor. Because if you're trying to act like you know everything, I mean, come on, there's just no way. There's no way. And I saw it happen after I graduated from PT school, going into the workforce where there were individuals, or even when I was a student, clinical instructors, where this kind of, I don't know, attitude of, I know everything. And I knew from the start that's not how I wanted to act. And also it's like that's just a breeding ground for like anxiety because you have to like act like you're something that you're not, you know? And
Mhm.
that could go down like a whole nother route of thinking that we're fixing people, and they're fixing themselves. We're just there to help guide them along the way. We're like the GPS and then in the car. So anyway, we're rambling now, but yeah, it was just really fun to get to have the opportunity to not only TA but do this TA with Roxy. So fun weekend.
I think another just maybe retrospective perspective, I don't know how many times you can say spective in a sentence, but I just did it twice, is thinking too. I remember that I think the Herman Wallace one, when I started my pelvic health career or portion of my career, is when I really kind of switched from this isolated approach of mechanical, fix the body, look at the ankle, look at the knee, what's the anatomy, what am I supposed to do here to fix this person? And really was challenged and have grown to step back and look at the person and understand the nervous system and understand more than just the mechanical piece of it, but what are the hormones doing? What's their diet and their hydration? What's their lifestyle, their activity level? Like that more holistic approach that really is effective. And I think that really looking back, and I think that was a little bit of when Megan, when you were talking about kind of trying to bite our tongues on things, of like, ooh, there's a lot more here that we dive down, but these gals are just learning to assess the pelvic floor. This is their first exposure. So we don't want to just like vomit overwhelming amounts of information on them. But also it's that thing of like, yeah, that's the right answer. But like,
we
like
know why it's the right answer.
Yeah, like let's keep going. Let's, let's go further. There's so many more pieces to this than just fix the muscle or like strengthen or relax the muscle. And so anyway, I think just even appreciating that, I think this was, where there was, it's like a landing point on my timeline of my career of saying, ooh, this is where my brain was really challenged to go to the places that it wouldn't have gone to by itself and treat the person in front of me rather than the symptom in front of me.
Right. And trust yourself to know how to do that. Yeah. And I think that Roxy and I were talking about too, and a lot of the therapists that came were heavy in ortho coming into the pelvic floor one course, which is so awesome to have a good solid skill set in orthopedic conditions. And so just knowing that even after you've learned what we learn in pelvic floor one, to apply that to even your ortho patients just takes it another step. And also to like confidence and being able to even like work closely at the tailbone and stuff like that, or like the adductors, where sometimes, I mean, historically, sometimes people get a little hesitant around those areas because they feel like, well, I don't want to make anybody uncomfortable and I don't want to. But like, if we don't address those things and we don't either get comfortable with it or find a therapist that is comfortable with it, then we're potentially causing more harm than good because we're not offering the service or the not service, but the treatment that a patient needs. So the pelvic floor course just it's just so good because it allows you to get more comfortable, having some maybe uncomfortable conversations and getting, confident and just going for it. And shoot, you get through that pelvic floor one course. I mean, you can do anything. It's so good. It's just so nerve wracking that first course, but it's so good. So
shout out though to Megan, to your clinic, because it was the coziest, most friendly and inviting environment of a course I've ever been to. So that was probably half the vibe, is just spending time in your lovely clinic. Y'all, if you're in Wichita, go to Kansas Public Health, just because I mean they are baller therapists, but also it's like the loveliest environment to be in. If you're gonna need
thank you.
pelvic rehab, you might as well look at pretty things and pretty plants and aesthetically pleasing treatment rooms that are fuzzy and warm. So anyway.
Yeah, Roxy took a cutting of one of our plants before she left. She's like, I gotta take a cutting of this. Do you mind? I'm like, go for it. And then somebody mentioned, she's like, oh my gosh, you have squatty potties in every stall. And I was like, sure do. But something you had mentioned earlier, Roxy, that reminded me when you were talking about like all the different aspects of now how we treat the whole person. And clearly I'm having a hard time staying on task tonight with my conversations. But we had a student with us for a little while. And so she wasn't with us too terribly long, but she was from a physical therapy clinic, or I'm sorry, physical therapy program in Oklahoma. And she said, she was like, wow, I haven't experienced the amount of time that you guys spend talking about other aspects of health in your appointments.
Mm.
And I loved hearing that because I do know that we do things differently. And it's a main reason why I feel like our patients do as well as they do. But also, too, like trying to get that to be more common, you know? And I know that often appointments are short. And so therapists feel like they can't spend time on those things. But like, I feel like we can't afford not to spend time on having these conversations about, you know, stress management and sleep and nutrition and movement. And if somebody isn't doing their home exercise program, spending time to figure out what those barriers are, and is it they don't enjoy it, or what is it? I mean, I uncovered with a patient the other day that she took the carpet out. She unexpectedly took the carpet out of an area, and I can't remember if I talked about this in one of my episodes, but like she was having a hard time being consistent because she didn't want to get down on the floor because it was hard. And I was like, yeah, I wouldn't either. So we were like, let's do it on the bed. So, I mean, sometimes you just have to like sit and have that little conversation and uncover that and not think to yourself, golly, why are they not doing this? Like, dig in and learn how to like work on motivational interviewing. There's so many aspects of what we do that we're just not taught from the beginning, you know, because there's so much we're taught. There's so much we learn in PT school that, you know, we're tested over. But then there's a lot that we're not. And so that's why you just have to continue to push and grow. And like, don't you just want to do that? You know, like how boring if we just stop learning.
Seriously.
Oh, seriously.
Seriously. No, I did. There's a new chiropractor at the clinic that our practice is inside, and she is doing more women's health type stuff. She's specializing in, but she's a new grad. And it was funny. She was just like quizzing me today. And it was really kind of exciting to just share because she's like, okay, tell me the difference in PT and OT and da 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 da. And like, you know, and
Yeah.
just that she's like, so how do you treat? And then how does your OT treat? And I was like, that's the funny thing. It's like, we all adopt, like we don't have to, we have our strengths, but we can also build off of our weaknesses. And I think it
Yeah.
is just that idea of like, oh, like how did we get here? Or what are we doing that
Mm-hmm.
no one's really said out loud maybe? So I think just like you talked about that, like going over those aspects of it's hard. I mean, I think just now being in pelvic health, we've been conditioned to say, okay, like, what are those barriers? And so we are just talking about hydration because that's the next most important thing to talk about. Does that make sense? And like,
Yeah. Yeah.
it's not that we have this necessarily this checklist of things that we make sure that we talk about with every patient. It's like we're looking at the person in front of us and saying, what do they need? Like, what's the low hanging fruit here? Like, what
Yeah.
is keeping them from progressing? And if it's going to bed on time, then by golly, I'm talking about going to bed on time and shutting your screen off and all these things that I wouldn't have ever thought was
Mm-hmm.
valuable or important before being in the pelvic health world and really having those dots connected and understanding how valuable our whole body's health is.
Yeah.
It was just kind of interesting talking with her today too, because it was like, oh yeah, we do that. I don't know how we knew to do that. It's just over, or like I've adopted that into my practice, but it's just been over time. I don't know. It was just interesting when she was like asking really like, well, what's the difference? Or what do you do? Or like
We do
who's
differently.
supposed to
Yeah.
see, like, are there certain patients that you're supposed to see versus her? And I was like, no, like
No. Nope.
we're both seeing the same. Like it's
Yeah.
good. It's
Yeah.
great. And like, I don't know. So that just kind of even made me think about how you were talking about spending a lot of time talking about things that aren't just pelvic floor or
Yeah.
musculoskeletal or physical therapy related, of how impactful that really is to the whole person. And then we do see results. And sometimes those results aren't just the complaint that they came in with that we're the most qualified to work on, but
Yeah.
sometimes it's other things too that just promote their overall quality of life, which is also meeting the goals that are in front of us that we
Yeah.
are supposed to be working on.
Absolutely. I mean, it's just really cool. I'm excited for where our profession is headed, especially like in regards to being in the pelvic health like space. And I think Pelvicon even kind of like lit even more of a fire this year with that, just with the topics discussed and the underlying commonality, I feel like, of the biopsychosocial approach. And really kind of like, I mean, it's stuff that we've known. It's just to see it finally talked about like on a stage and like going out and saying the stuff and potentially being like, okay, if we don't unpack, if we don't get you to the right maybe therapist to unpack that trauma, like your physical symptoms, are we going to be able to resolve those? Like we have to know that, yeah, there's just all different approaches. So, and I think that, honestly, like I was just had somebody today that I was talking to that Abby and I actually kind of like both see, which does not happen all that often, but it has for a couple of people. And two of them happen to be IC patients, interstitial cystitis. And it has actually worked out fantastic. And the patients like end up, honestly, after we start both seeing them, they kind of take off because there's slight differences between Abby and I. We have slight different approaches. And so when you put those two approaches together, it's like, okay, it's cool to see it happen, even though they're similar, yet slightly different. I think even the patients are like, yeah, this is kind of nice and so it might be that like I see the patient and the next visit Abby does, and then we kind of do that back and forth, or I see him for a couple. And then obviously there's the aspect of if they need like dry needling done, that's what I don't dry needle, Abby does. But it's kind of been cool to see that happen with a couple of people. Cause then you think about all the complex patients where maybe that's the best thing for them is to combine two therapist skills together, because we are who we are. We're individual and our energy and how when we touch our patients, like how their body responds. Like there's so much cool stuff going on. So yeah, we're wrapping up here into the last couple of months of the year. And we have some fun people that we're thinking of bringing on the podcast, and maybe just some of our friends. Like we just have such a good circle of colleagues that are sprinkled all throughout the country. And I was thinking about how fun it would be for us to like get a group of us on here, and
It would be
even
wild. I would be
multiple
giddy.
groups. I mean, like
I would be like a middle school girl.
who knows what we would be talking about?
Let's do it.
I think we
Group
should.
Party.
Our little Facebook group we have, we'll just get everybody on. And I think it's kind of a lot of people. So, well, not a lot, but a good chunk. So maybe we break it up into two or something.
We may or may not record it. We may or may not record that. It could get a little wild.
Well, we hope that, listen, you enjoyed listening to us banter back and forth. There really was no major, like ending point with this episode, but that's okay. Hopefully the education is just know that if you're a therapist listening to this, new into pelvic health, keep going, find a mentor.
And if you're not a therapist, keep going, find a mentor.
Yeah. And if not a therapist, keep going, find a mentor. Yes. Just in life, everybody keep going, find a mentor.
Go to bed on time.
Clearly we are not. No, it is
Practicing
late.
what we preach.
I know. All right. Well, I could go down a few other rabbit holes here, just chit-chatting with you, but we'll stop. So until next time, we promise next time it will be a directed discussion on a topic, but it's always a good time. Next time, we'll continue the conversation. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.